Hello student, a very good evening to all of you. I hope I am audible and visible at your end. So, just give me a thumbs up. Hi Dr. Hers. I think I am audible and visible at your end. Na? Just give me a thumbs up. Yeah, thank you so much, thank you so much. So, I hope that your exam was went well, and it's a great session. But what I have seen after looking at the questions of physiology, that there are many questions this time they have asked from physiology. Okay, altogether 15-16 questions they have asked from physiology. So, as you can understand here, so this is this subject is going to be more and more important for your future exam also. Okay. So, many student has joined. So, thank you so much for joining, Dr. Harsha, Dr. Hacker, I do not know who is Dr. Sonal and all, I am not taking names of all of you. So, thank you for joining. Not went well. Some of the questions are a little tricky, I believe. Yeah, tricky. Yeah, some of the options were there which are not very good options. So, please conduct some revision session for INI-CET. Obviously, there will be revision session. No worry for that. Okay. Okay. So, I believe that all of you know that this elite plan for FMGE is also going on in our platform, and this code you can use for a discount. Okay. And this session, this is the common disclaimer that we give for all session, that this is not for the exact question, this is the recall question from the students. So, at any point of time during this discussion or during this session, if you feel that some of the options are not correct, some of the options were different in the actual question, so please let me know, so that I can correct them, and ultimately those correct question will be uploaded in the PrepLadder platform. So, that is the ultimately target of this session. So, anyhow need to pass, you require only 150 for passing the exam. Okay. So, we are going to discuss the question and their answer directly, because I believe that you have given the exam and you are already tired enough and you are in tense situation that what will be the result. So, look at the answer, possible correct answer of this question. Okay. So, in physiology I told you altogether 15-16 questions are there. So, the first question that I have kept here, this is a very common question in physiology as well as medicine, that in jugular venous pulse the A wave. So, in my class also, in my lecture also, I have discussed A wave is for atrial contraction. Okay. So, A for atrial contraction, and this right atrial filling will produce the V wave. Okay. Right atrial relaxation will produce the X deviation, and the tricuspid valve bulging will produce the C wave in the JVP. So, the A wave is going to be produced by right atrial contraction, and I believe all of you have done correctly. There is no confusion in this, very simple question. Okay. But all questions are not very simple, some of the questions are little tricky. Okay. Now, the second question here, which electrolyte abnormality will leads to cardiac arrhythmia in severe vomiting? So, cardiac arrhythmia can be precipitated by the hypokalemia also, hyperkalemia also, and even the calcium also. But the catch here is the severe vomiting. So, whenever there is severe vomiting, we all know that what is going to happen, the common abnormality, electrolyte abnormality is the chloride will be lost and the potassium will be lost from the body. So, the hypokalemia is the typical abnormality, okay, that will happen in case of severe vomiting, and hypokalemia can also causes cardiac arrhythmia. So, hypokalemia as well as hyperkalemia both can causes cardiac arrhythmia, but here the answer will be hypokalemia, considering that the person is suffering from severe vomiting. So, there will be loss of the GI fluid, and you know most of the GI fluid contain high amount of potassium. So, the potassium is going to be lost from the body and the person will suffer from hypokalemia. Got it? Very good medicine question, yes, I believe. Okay. Now, the next question, a patient with high blood pressure. Okay. Now, this is one of the tricky question, accompanied by a decrease in the heart rate. So, the pressure, hypertension is there, BP is high, but the heart rate is slower. Typically, this kind of features we have read during the discussion of the Cushing reflex. Cushing reflex, when we are discussing, in those Cushing reflex we have discussed that Cushing reflex means there will be hypertension, along with that there will be bradycardia. But this is not the Basal-Gerry's reflex. Okay. This question was there, this question, this was the exact question, could you recall? Okay. Otherwise, if you are discussing the answer without the correct question, then this is not a correct scenario. But I am telling you here, if you have marked Basal-Gerry's reflex, this is wrong. This Basal-Gerry's reflex means there will be hypotension also, there will be decrease in blood pressure also, there will be decrease in heart rate. So, hypotension and bradycardia, that is the typical phenomena. It is not there at all. Okay. But anyway, no sir, not this question. Okay. Some alpha baroreceptor. Okay. Okay. So, that is why this question is looking a little bit tricky type. So, stimulation of the baroreceptor means there will be decrease in sympathetic. So, heart rate will decrease as well as blood pressure will decrease. Inhibition of baroreceptor will have the opposite. So, this is not my answer. Only the chemoreceptor stimulation may have this kind of symptoms. So, if you stimulate chemoreceptor, it stimulates the blood pressure center area, that is the vasomotor center. So, this is only possible if there is stimulation of the chemoreceptor, but as you are saying here, this question was not there. So, we are not giving much importance to this question, but Basal-Gerry's is not the answer in this question if it is there at all. Okay. Now, we are coming to the next question. Which of the following describe the chloride ion exchange in red blood cell where bicarbonate ion are exchanged for chloride ion to maintain the electroneutrality? So, again a very okay, norepinephrine injection. Okay. So, that norepinephrine, that is a pharmacology question as well, no beta 2 action. So, there will be okay. So, forget about this question. So, now come to this. So, here do you recall hamburger was also option and chloride chips was also option? Both were there in the option. Okay. Because if both are there, then the both are correct. Both are correct. Because chloride chip, the other name of this chloride chips is the hamburger phenomena or hamburger effect. Both were there in the option. Okay. Only hamburger, yes. So, hamburger was there, chloride was not there. So, this hamburger effect is also the chloride shift. So, obviously, so the here the answer will be hamburger effect. Hamburger effect is also known as the chloride shift phenomena. Okay. Very good, very good. So, you have done well, very good. So, why are you saying the question, the exam was not went well? Maybe other subject was difficult, na? Okay. So, only chloride. Okay. Hamburger effect is also known as the chloride shift. So, the answer will be chloride shift or hamburger effect, any of them. Both if it is there, then it is difficult, but again chloride shift is a better answer if it is there in the options. Okay. Now, coming to the next question, which of the following factor causes a rightward shift in the oxygen hemoglobin dissociation curve? Now, Halden-Bohr is not the answer of the question, and Halden-Bohr we are not discussing here because of the time limitation. So, Halden and Bohr effect, that is related to oxygen and carbon dioxide transport, not for the chloride shift phenomenon in the RBC. Although during this chloride shift phenomena the Halden effect is going to happen, but that is a different one. Okay. So, here okay, increase in carbon dioxide was not there, but rather than acidosis was there. Very good, no problem. So, increase in carbon dioxide or acidosis, whatever was there. So, that was the answer of this question because it is a direct question. It is a direct question. Okay. Rightward shift of the oxygen hemoglobin dissociation curve, all of you know what is the causes. So, acidosis, hypocapnia, hypothermia. Very good, very good. Okay. So, rather than this, hypocapnia was there in the option, hypocapnia. Okay. Thank you so much. Thank you so much. Very good. Very good, Dr. Harsha, Dr. Saurabh. Okay. Thank you. Thank you so much. So, A is the correct answer here. No problem. Okay. Okay. So, the next question here. A 50-year-old patient presented with respiratory difficulty and a history of chronic smoking for the last 30 years. Okay. 2-3 dpg decrease. Okay. So, I will change it here. Decrease 2-3 dpg. So, it is also not correct. So, okay. Yes. So, here okay, I did not get this question, but look at this question. This question was there most probably because most of the students are saying that chronic smoking history was there and this FEV1 percentage. So, whenever we say FEV1 percentage means FEV1 upon FVC, FEV1 in terms of FVC, that is the FEV1 percentage. So, FEV1 upon FVC, this percentage is reduced. So, this indicates that this is a kind of obstructive type of disease. Okay. So, in these examples, obstructive disease I can find out this is the obstructive one, and the asthma was not in the option. So, there is no other obstructive disease here. So, only one answer is possible here, that is the chronic obstructive pulmonary disease. Carcinoma lung. So, carcinoma lung was there in place of which option, Dr. Gautam? Could you recall anybody? Thankfully, there was no asthma. Now, even if it was asthma in the option, so you should go for the COPD, I mean chronic obstructive pulmonary disease only, because asthma is a kind of thing which is triggered by the acute stimulus. Na? So, chronic smoking history is typically for the COPD. So, TB was not there. Okay. Interstitial lung disease was also there. Okay. Not. Okay. So, I am putting here that CA lung may be also in the option. Okay. Thank you so much. No tuberculosis. Okay. Okay. CA lung will be better choice here. Okay. Thank you so much. Good. Okay. Next question में आ जाओ. Which of the following changes occur during muscle contraction while exercising? So, while you are exercising or not, muscle contraction means we all know what is going to happen. So, if these are the Z line, we all know that in between Z line there will be decrease in the length. So, the I band length is going to be decreased, but the A band, so the myosin will form the A band will remain same, and at the center of this there will be M line. So, I told you in my classes that M length increases नहीं होता है, M line will be prominent during muscle contraction, M line will be prominent. So, this is not my answer. A length decreases, no, A length will remain same. So, this is also not the question. Okay. I length decreases, absolutely true statement, and this is going to be answer. Sorry, because the next is also given M length increases. So, M length is not going to be increased, either it will be reduced or it will be prominent, that is the answer, and I band decreases. So, this is partially true. So, this is not the answer. So, only the I length decreases is the correct option here. Okay. So, let us see what he was saying. Okay. So, LRR, yes, LRR and rapid revision, most of the topics will be covered, So, C is the correct answer here. Yes, yes doctor, C is the correct answer here. I marked wrong. Why you marked wrong, doctor? Okay. M line like most probably you get confused. Okay. So, M line is the line at the center of the sarcomere. Wrong हो गया, कोई बात नहीं. So, answer is the I length decreases, that is absolutely true. Both M length increases, I length decreases, that is also not true. A and I both will not decrease, A will remain same. So, only option possible here is the I length decreases. Okay. Now, the next question here is, what is the mechanism of action of botulinum toxin? So, again microbiology as well as physiology, in both the area I have talked about botulinum toxin. So, botulinum toxin basically destroy the SNARE protein, SNARE protein को destroy कर देते हैं ना, and if the SNARE protein is destroyed, then what will happen? The vesicle release will be problem, and we all know that the botulinum toxin specially act at the level of NM junction, neuromuscular junction. So, answer is that botulinum toxin will causes destruction of the SNARE protein, and by destructing the SNARE protein, it will inhibit the release of acetylcholine from the presynaptic terminal. प्रीसिनेप्टिक टर्मिनल मीन्स बेसिकली द मोटर न्यूरॉन टर्मिनल से इसको डिस्ट्रॉय कर देंगे. ठीक है. टेस्टोस्टेरोन वाला क्वेश्चन रखा है मैंने यहाँ पे, देखोगे आप. ओके. इनिविन होगा आंसर. ओके. सो इसमें कोई ऑप्शन में कोई प्रॉब्लम नहीं है. आई डोंट थिंक दैट यू हैव अ प्रॉब्लम इन दिस क्वेश्चन. सो बोtulinum toxin मीन्स इनहिबिट द रिलीज ऑफ acetylcholine फ्रॉम द presynaptic terminal. Okay, great. Next question. Which segment of the nephron has the lowest osmolality under the influence of antidiuretic hormone? Again, this topic I told you repeatedly in my lecture classes, that suppose this is a nephron, okay, whether the diagram is given or not, okay. If the ADH is there, then ADH will reabsorb water from this collecting duct, okay, and because of the water reabsorption from the collecting duct, urine will be very concentrated here at the end of the collecting duct also, and urine will be very concentrated at the tip of the loop of Henle. So, the lowest concentration will be here at the level of DCT. So, best option of this question. Okay. So, the late distal tubule will be the answer. क्वेश्चन क्या था बता पहले, क्वेश्चन क्या था, एडीएच कहाँ पे काम कर रहा है, ये क्वेश्चन था, तुक्का मारा, तुक्का मार के तो गलती हो गया ना. So, question answer is not the collecting duct, because at the level of collecting duct ADH is working. Answer is not where the ADH is working. Answer is at which part under the influence of ADH urine has the lowest osmolality. Okay, which segment of the nephron has the lowest osmolality under the influence of antidiuretic hormone. Question को समझो पहले. ओके, सो हम लोग क्या जानते हैं कि जब यूरिन फ्लो होता है आइसोटोनिक होता है पीसीटी में आइसोटोनिक होता है. उसके बाद जब ये डिसेंडिंग थिन ऑफ लूप ऑफ हेनले में जाते हैं तो ये धीरे धीरे कॉन्सेंट्रेट हो जाता है. उसके बाद जब ये असेंडिंग लिम्ब ऑफ लूप ऑफ हेनले के थ्रू जाता है तो सॉल्यूट धीरे धीरे एब्जॉर्ब हो जाता है. तो जितना सॉल्यूट एब्जॉर्ब होते जाएगा तो ये डीसीटी में जाके क्या हो जाएगा, बिल्कुल डाइल्यूट हो जाएगा. अब जब कलेक्टिंग डक्ट में फिर से जाएगा तो एडीएच है ना, तो इसीलिए यूरिन फिर से कॉन्सेंट्रेट हो जाएगा, तो कलेक्टिंग डक्ट इसमें आंसर नहीं हो पाएगा. इफ इट इज एब्सेंट ऑफ एडीएच देन कलेक्टिंग डक्ट आंसर होगा. सेम क्वेश्चन मान लो क्वेश्चन पूछा है बट अंडर द इन्फ्लुएंस ये वाला नहीं है, मान लो अंडर द देर इज नो एडीएच, एब्सेंस ऑफ एडीएच, देन आंसर हो जाएगा कलेक्टिंग डक्ट. बट इन दिस क्वेश्चन कलेक्टिंग डक्ट नहीं होगा, अंडर द इन्फ्लुएंस. ओके, सो अंडर द इन्फ्लुएंस ऑफ एडीएच, यस एक्शन पूछा था. I recall early distals only given, early distal, late distal was not given. So, distal tubule will be the answer, but because I am getting that some of the students are saying early and late distal tubule is there, then what is the thinking is that throughout this late distal tubule the urine will go on decrease in concentration, means more and more absorption of solute will be there and urine will be more and more highly diluted. So, at the end of this distal tubule will be the answer. Better answer is this one, late distal tubule. But if early and distal, late distal was not separate, suppose A and D separate option नहीं है, then आपका आंसर होगा DCT, distal tubule will be the answer. एक बार चैट पढ़ लेता हूँ क्या बोल रहे हो आप लोग. Only early was in the option, sir. They mention cortical and medullary. Whatever, cortical collecting duct और medullary collecting duct, ADH दोनों जगह पे काम करते हैं. medullary में ज़्यादा एक्शन है बट कोई भी नहीं. सर ऑप्शन वॉज medullary collecting duct, cortical. No, under the influence was there. So, absence of ADH was there. अब कौन बोल रहा है absence of ADH was there? Under the influence of ADH था. Absence of ADH होगा तो भैया इसका आंसर हो जाएगा collecting duct. ओके, बट अंडर द इन्फ्लुएंस ऑफ एडीएच बोलोगे तो एडीएच कलेक्टिंग डक्ट में वाटर को एब्जॉर्व करते जाएगा और यूरिन कॉन्सेंट्रेट होते जाएगा, ऑस्मोलैरिटी कम नहीं रहेगा, ज़्यादा हो जाएगा. सर दे आर मिक्सिंग टू क्वेश्चंस. वन क्वेश्चन वाज फार्मर रिगार्डिंग एसिटाजोलामाइड, हाँ, एंड द अदर ऑप्शन लोएस्ट ऑस्मोलैरिटी अंडर एब्सेंस. सो हम यहाँ पे लिख देते हैं. ओके, एब्सेंस, सेम क्वेश्चन, एब्सेंस ऑफ एडीएच, देन आपका आंसर हो जाएगा कलेक्टिंग डक्ट सी. बट अंडर द इन्फ्लुएंस ऑफ एडीएच, under the influence of ADH, they are not asking you where ADH work, what is the site of action of ADH, ये क्वेश्चन नहीं है. इसमें आपका आंसर होगा DCT. So, late distal tubule if it is there, late distal tubule if it is there, it will be answer. But if late is not there, then early distal tubule will be the answer. Under the influence, which is the best? मैं बोल रहा हूँ ना, कॉर्टिकल भी नहीं होगा, मेडुलरी भी नहीं होगा. बात समझ में नहीं आ रहा. कॉर्टिकल हो जाए, मेडुलरी कलेक्टिंग डक्ट हो जाए, दोनों में जाके यूरिन का कॉन्सेंट्रेशन बढ़ते जाएगा क्योंकि एडीएच का एक्शन वहाँ पे शुरू हो जाएगा. आंसर इस क्वेश्चन का होगा सिर्फ एंड सिर्फ डिस्टल कॉन्वोलेटेड ट्यूब्यूल, डिस्टल ट्यूब्यूल आंसर होगा. ठीक है, लो ऑस्मोलैरिटी, वही तो बोल रहा हूँ ना, लो ऑस्मोलैरिटी. ओके, टिप ऑफ लूप ऑफ हेनले में ऑस्मोलैरिटी हाई हो जाता है. ओके, एंड कलेक्टिंग डक्ट में भी हाई हो जाता है. फिर गलत हो गया ना, हाँ, ये क्वेश्चन ट्रिकी था. ऑप्शन वाज कॉर्टिकल, मेडुलरी, पीसीटी, बस और कुछ नहीं था. कॉर्टिकल कलेक्टिंग डक्ट, मेडुलरी कलेक्टिंग डक्ट, पीसीटी और मे बी अर्ली डिस्टल ट्यूब्यूल. देन इन दैट केसेस अर्ली डिस्टल ट्यूब्यूल विल बी द आंसर. बट मैं बार बार बोल रहा हूँ ADH का अंडर इन्फ्लुएंस ऐसे टाइप का क्वेश्चन दिया है तो कलेक्टिंग डक्ट आंसर नहीं होगा भैया, आंसर होगा डिस्टल ट्यूब्यूल, ओके, DCT, ठीक है, ये आंसर इस क्वेश्चन में, ओके। नाउ नेक्स्ट क्वेश्चन, renal biopsy image was given. If the absence of ADH, then medullary collecting duct will be the lowest concentration of the urine. Medullary collecting duct will be the answer because cortex के बाद medulla आता है। आप बात समझो, ADH होगा तो cortex से water absorption शुरू हुआ है, तो ADH धीरे धीरे उसको concentrate करते जा रहा है, और ADH नहीं है तो जो यूरिन डाइल्यूट होके आया है वो फर्दर डाइल्यूट हो जाएगा कलेक्टिंग डक्ट का एंड तक जाते जाते। तो कलेक्टिंग डक्ट का एंड मतलब कौन सा, मेडुलरी कलेक्टिंग डक्ट ना। सो एब्सेंस होगा तो मेडुलरी कलेक्टिंग डक्ट आंसर होगा। अब हाई ऑस्मोलैरिटी आ गए हो, नहीं मेरे को तो जो क्वेश्चन है लो ऑस्मोलैरिटी, तो हाई ऑस्मोलैरिटी होगा तो उसका आंसर डिफरेंट है, ओके ओके चलो। हाँ, सो ये जो क्वेश्चन है ना, इसमें देखो एक डायग्राम देके रखा है, जिस डायग्राम में ये बेसिकली आपका ग्लोमेरुलस है, ओके, ये बेसिकली ग्लोमेरुलस। सो हम लोग जे अपरेटस का डायग्राम में कैसे देखे थे, ऐसे ग्लोमेरुलस होगा एंड ग्लोमेरुलस के सामने ये हमारा डिस्टल लूप होगा, ओके। सो दिस इज द ट्यूब्यूल का पार्ट है, डिस्टल ट्यूब्यूल का पार्ट है, एंड इन बिटवीन ये हमारा अफरेंट एंड इफरेंट आर्टरियल होगा, एंड इसके बीच में जो सेल्स आएगा ना, इस सेल को हम लोग बोले थे लैसिस सेल्स, इसी सेल तो था ना लैसिस सेल्स, एंड लैसिस सेल का और एक नाम होता है एक्स्ट्रा ग्लोमेरुलर मेसेंजियल सेल। सो देखो इसमें जो डायग्राम देके रखा है ना, जहाँ पे ये हाईलाइट किया है, इफ दैट इज ट्रू देन दिस इज द डिस्टल ट्यूब्यूल एंड लूप ऑफ हेनले का पार्ट, एंड ये हमारा बेसिकली, सो ये डिस्टल ट्यूब्यूल का पार्ट है एंड ये हमारा ग्लोमेरुलस हो गया। सो जहाँ पे ये ग्रीन कलर का हाईलाइट देके रखा है ना, दैट इज़ टिपिकली इंडिकेटिंग लैसिस सेल। सो लैसिस सेल होगा तो ये एक्स्ट्रा ग्लोमेरुलर मेसेंजियल सेल्स है, ये आपका आंसर होगा। समझ में आ रहा है? बट सम ऑफ द स्टूडेंट्स आर सेइंग कि हाईलाइट इस जगह पे नहीं था सर, हाईलाइट इस जगह पे था, तो हाईलाइट यहाँ पे था मतलब ये बेसिकली ट्यूब्यूल का पार्ट है, तो ये बेसिकली आपका मैकुला डेंस आंसर हो जाएगा। सो ये आपका एग्ज़ाम में जैसे देखो वही है, बट सम ऑफ द स्टूडेंट्स आर सेइंग सर जो ये हाईलाइट पोर्शन था ना, ये क्लियर कट ट्यूब्यूल के बाहर था, क्लियर कट ट्यूब्यूल के बाहर होगा तो ये आपका आंसर होगा लैसिस सेल, एक्स्ट्रा ग्लोमेरुलर मेसेंजियल सेल्स, ओके। हाईलाइट वाज राइट, देन इट इज एक्स्ट्रा ग्लोमेरुलर मेसेंजियल सेल्स, वेरी गुड, थैंक यू सो मच, ओके। नाउ नेक्स्ट क्वेश्चन, next question here, dehydration is more severe in infant compared to adult। ये हम लोग जनरली MBBS में क्वेश्चन देते हैं कि इन्फेंट में डिहाइड्रेशन सीवियर हो जाता है। हम लोग बताते हैं क्यों, क्योंकि दे हैव मोर सरफेस एरिया इन कंपैरिजन टू देयर बॉडी वॉल्यूम, सो सरफेस एरिया रेशियो इज वेरी हाई, सो देयर इज लॉस ऑफ मोर वाटर फ्रॉम द सरफेस एरिया, ह्यूज सरफेस एरिया। सेकेंड वी से दैट in our body ICF, intracellular fluid, is more than that of the extracellular fluid, but in infant extracellular fluid volume is more than that of the ICF. So if you look at this diagram, this graph, this I have explained in my lecture. So this diagram is saying that extracellular fluid initially at the point of birth is higher than intracellular fluid, आफ्टर दैट एक्स्ट्रा फ्लूइड धीरे धीरे कम होते जाता है एंड इंट्रासेलुलर फ्लूइड बढ़ते जाता है। सो बेसिकली जो डायरिया में, डिहाइड्रेशन में फ्लूइड लॉस होता है ना, वो एक्स्ट्रा सेलुलर फ्लूइड से पहले लॉस होता है, एंड इन्फेंट में क्या होता है, एक्स्ट्रा सेलुलर फ्लूइड इज लिटिल मोर देन दैट ऑफ द इंट्रासेलुलर फ्लूइड। सो इसीलिए इन्फेंट will have severe dehydration because their body surface area is also higher and their extracellular fluid is more than that of the intracellular fluid. Now if you look at the graph, it is also saying that the percentage of the body water is higher in infant. Means if you look at the percentage of body water in my body, then total body weight का 60% is the body water inside my body, but infant may have around 80% of their body weight is because of the water, but this is percentage of body water is higher. Total body water if you measure, that is obviously not higher in infant. So this C option is not fully correct because it is said total body water in infant is more than adult. This is not, total percentage of body water is more in infant. So this is false. बाकी दो ऑप्शन आंसर नहीं हो सकता है, सो ओनली ऑप्शन पॉसिबल हियर इज द ए, दैट इज द एक्स्ट्रा सेलुलर फ्लूइड इज मोर इन केस ऑफ इन्फेंट, दैट्स वाई। ठीक है, हार्ड ही है, लिटिल बिट हार्ड तो है ही, समझ में आ रहा है। ओके, सो इन्फेंट में इसीलिए डिहाइड्रेशन का चांसेस ज़्यादा होता है, समझ में आ गया ये क्वेश्चन। ओके, नेक्स्ट क्वेश्चन, A hypertensive patient's lab result shows hypernatremia, अच्छे से देखो, हाइपोकैलेमिया, मेटाबॉलिक एल्कालिसिस। क्वेश्चन ठीक है, स्टेम ऑफ द क्वेश्चन ठीक है कि आपको लग रहा है ये क्वेश्चन नहीं था, डिफरेंट था। सो एडिशन में क्या होता है, एल्डोस्टेरोन नहीं होता है, ओके। सो सोडियम रीअब्जॉर्प्शन नहीं होगा, सो हाइपरनेट्रीमिया तो पॉसिबल नहीं है, तो एडिशन को पहले ही निकाल दो, ओके। बाकी तीनों डिजीज तो देखे रखा है ना, कोन्स, बार्टर एंड जिटलमैन, तीनों में ही पोटासियम लॉस हो जाता है, हाइपोकैलेमिया, मेटाबॉलिक एल्कालिसिस होता है, तीनों में ही होता है हमारा, हाइपोकैलेमिया भी होता है एंड मेटाबॉलिक एल्कालिसिस भी होता है, मेटाबॉलिक एल्कालिसिस भी होता है। हाइपोनेट्रीमिया था ये। सो इन दिस क्वेश्चन हाइपोनेट्रीमिया नहीं था, मेरे को जो लग रहा है ना, इसमें हाइपोनेट्रीमिया नहीं दिया जाएगा, क्योंकि हाइपोनेट्रीमिया बार्टर में भी हो सकता है, जिटलमैन में भी हो सकता है, ओके। एंड लीडेल्स तो ऑप्शन में नहीं था। सो इस क्वेश्चन में जो आंसर होनी चाहिए, इफ इट इज़ हाइपरनेट्रीमिया देन इट इज़ हाइपर एल्डोस्टेरोनिज्म, प्राइमरी हाइपर एल्डोस्टेरोनिज्म, and that is the Cone syndrome, because Cone syndrome also causes this hypokalemia, metabolic alkalosis, but apart from that it will absorb sodium because of the aldosterone excess in the body, okay. So इसमें आंसर Cone syndrome होगा, but if you are saying hyponatremia था, then answer different होगा, then Bartter will be the more prominent answer here, although Gitelman can also be answer, okay, and addition भी उस टाइम में आंसर होना possible है। So most probably it was not hyponatremia, it should be hypernatremia along with this kind of feature, then Cone syndrome is the better fit in this question, okay. But again, if you feel that the option was different or question stems was different, please message me later on in my Instagram also, maybe in the PrepLadder platform also, I will reply, or maybe in this YouTube session, I generally check the comment even after the session, so you can contact me there, okay. Okay, very good. So the next question, and this is the last question, okay, no problem dear, if you can recall even after later also, please do let me know in the chat box, in the I mean YouTube video post, okay. So during spermatogenesis, which of the following hormone inhibit follicle stimulating hormone? This is again a little simple question, but sometimes it may become difficult because you know ki FSH and LH, okay, both control this, but LH causes secretion of the testosterone and testosterone has inhibitory feedback on LH, but here they are specifically acting FSH. So FSH, okay, stimulate the inhibin production from Sertoli cell, and this inhibin basically inhibit the FSH production from pituitary. So the question is, during spermatogenesis, which of the following hormone inhibit FSH secretion? Okay, answer is inhibin, inhibin, inhibin. Getting my point? So this answer is the inhibin. So this is all about the recall question that has been given to me, that around 15 to 16 question was there in the physiology session. So I believe you have done good because most of the answer you are giving correctly. So 1-2 mistakes is acceptable because ultimately you have to get 150 marks, okay. So good luck to you, all of you doctor, okay. Best of luck for your exam result. I believe you are going to crack this time. Thank you so much for listening, and please let me know if some of the questions you are recalling later on, that exact question, exact answer was a little different, please let me know in my Instagram or maybe in the YouTube video. Thank you so much. Bye bye. Take care.